Can you all see the slides? Yes?
Yes.
Okay, great.
You might want to expand it though, because we can see kind of the slideshow on the left-hand side. So we're just seeing what you see probably.
Well, I just started the slideshow, so all I see is the slideshow. So you're seeing more than just the slideshow?
Yeah, it's like not a whole full screen. It's your notes and.
Well, that's weird. I'm not used to doing this in Teams, so hold on one second.
Right, the presenter view is what.
Yeah, no, I know. For some reason, it's, even though I'm not looking at it like that, it's weird that it's showing you that. Hold on one second. So if I do it this way, you guys can see the notes, but even when I start the slideshow, you can still see the notes. Is that right?
There we go.
Okay, there we go.
Okay.
Yep.
All right, great. Okay. So I am Jessie Putkowski. I am the area director for the Western Pennsylvania chapter of the American Foundation for Suicide Prevention. We have been over the past, 2 years amid an unprecedented public health crisis, yet we also have an extraordinary opportunity to come together within our families and our communities to reduce the stigma that often surrounds mental health. And as the Western PA chapter of a national organization, we have so many tools and resources to help facilitate dialogue with those who may be isolated and or need extra support. So let's go over what we're going to talk about today. We'll spend a few moments on who AFSP is as an organization, provide some updates on what we do as a chapter that are available, which we can do virtually and in person right now, focus on mental health and share some self-care tips, and then we'll close on some helpful resources. So about AFSP. The American Foundation for Suicide Prevention's mission is to save lives and bring hope to those affected by suicide. We are the voluntary health organization that gives those affected by suicide a nationwide community empowered by research, education, and advocacy to take action against this leading cause of death. So the organization was founded in 1987 by researchers and families who had lost loved ones to suicide and wanted to take action. And today, AFSP combines science and grassroots and gives those affected by suicide a nationwide movement of over 1 million people, and we do have chapters in all 50 states. So AFSP creates a culture that's smart about mental health by engaging in the following core strategies. We are the leading private funder of scientific research related to suicide prevention. We educate the public about mental health and suicide prevention. We advocate for public policies in mental health and suicide prevention, and we support survivors of suicide loss and those affected by suicide. So with local programs and events in all 50 states, our chapters are at the forefront of suicide prevention. We create a culture that's smart about mental health through education and community programs, research, advocacy, and support. And our chapters engage with families, mental health professionals, community, and local business leaders, school administrators, and others interested in preventing suicide. And our Western PA chapter is here to be a resource to the community. We cover 25 counties in Western PA, obviously including Allegheny County, fueled by efforts of volunteers to help save lives and support those affected by suicide. The grassroots work we do focuses on eliminating the loss of life from suicide by delivering programs, educating the public about risk factors and warning signs, raising funds for suicide prevention research and programs, and reaching out to individuals who have lost someone. We do not directly provide mental health or crisis services. We have educational trainings about suicide and mental health. We have got programs for loss survivors and those with lived experience, and informational resources to community members and partners. As an organization dedicated to saving lives and bringing hope to those affected by suicide, we are leading by example and practicing healthy behaviors for ourselves and one another during COVID-19. This includes moving our community programs to an online platform to ensure that our life-saving work is still going strong in communities across the country. And our programs include Talk Saves Lives, More Than Sad, It's Real, Healing Conversations, as well as the other events that we have. So we do have our Talk Saves Lives program. It's an introduction to suicide prevention. This is a standardized presentation that covers the scope of this leading cause of death, what the research has found to be the warning signs and risk factors of suicide, and the strategies that prevent it. We have our It's Real presentations. We actually have an It's Real college students in mental health and an It's Real teens in mental health, and our More Than Sad for teachers and other school personnel that teaches educators to recognize the signs of mental health distress in students and refer them for help. The suicide prevention program complies with the requirements for teacher training in many states. And then we also have one for parent education. The program helps parents recognize signs of depression and other mental health problems to initiate a conversation with their child and support help seeking. And these are a sample of the different educational materials that we have. So our loss and healing program, which is available on the phone or via video chat, gives those who have lost someone to suicide the opportunity to speak with our experienced volunteers. Our trained volunteers have experienced suicide loss themselves and know firsthand the pain associated with this type of loss. They are familiar with the isolation that so often accompanies a death of this kind and are able to show suicide loss survivors a way forward into a world of support by creating an opportunity for the newly bereaved to speak openly with and ask questions of someone who has been there too and truly gets it. When someone contacts us to request a conversation, we will ask them some questions about their loss so that we may match them with a suitable volunteer who has experienced a similar loss. Their peer support volunteer will then contact them to schedule a conversation at a convenient time, and in the case of in-person visits, at a comfortable location of the person's choice. We also have our International Survivors of Suicide Loss Day that we have. It's always a Saturday before Thanksgiving. It's a day of hope and healing and connection. And we have different documentaries related to the journey of grief, loss, and hope and healing after a suicide loss. And then we have a variety of resources for both survivors of suicide loss and those interacting with them. We have our Children's, Teens, and Suicide Loss, which is a booklet available, it's also available for purchase and a digital flip book. It's a wonderful resource on how to talk with kids about suicide loss. It helps parents and caregivers understand how children process grief and loss. And then we have an after suicide toolkit that helps various systems navigate a suicide loss in their specific community. We have different listings of books and films that may be helpful, and we also have a database of suicide loss support groups on our website. And we also maintain a database of licensed mental health professionals that have attended our suicide bereavement clinician training program, which was developed to better equip clinicians in best practices with loss survivors. Project 2025 is our bold goal to reduce the national suicide rate 20% by the year 2025, focusing on 4 crucial areas of firearms, emergency departments, correctional institutions, and healthcare systems. We are taking steps to save the most lives in the shortest amount of time. And if you want more information on that, I'd be happy to send it to you. So the COVID-19 pandemic has presented a variety of challenging experiences for people, no matter if you have a personal struggle, are concerned about a family member or someone close to you, or have experienced a loss. It is crucial in this time that we focus on shoring up on our mental health and well-being. We're going to listen to AFSP's Chief Medical Officer, Dr. Christine Moutier, as she speaks about caring for our mental health amid COVID-19.
I'm Christine Moutier, the Chief Medical Officer at the American Foundation for Suicide Prevention. Thank you for taking the time to attend this program that you're about to participate in. I wanted to make a few comments since we are in the midst of this public health crisis related to the coronavirus. Factors associated with COVID-19, such as anxiety and social isolation, fears about the virus itself, and the potential for economic strain on families. Everyone is making adjustments, and every single situation is important for us to consider as it relates to the impact on our mental health now that we're in the middle of this unusual time. So I wanted to just explain a few things about what you're about to hear about suicide risk and prevention so that there is not an unintended combining of or linking of coronavirus with suicide risk. In fact, based on research available currently, it is not a foregone conclusion that COVID-19 and the crisis that we're in will have an impact on suicide on a population level. While factors associated with COVID-19 can, in fact, create risk, it is more important than ever that we remember that suicide is preventable. And so it's a time when we can pay attention to all the proactive measures that we can take to protect our mental health. And for those who have specific vulnerabilities, such as depression, PTSD, addiction, or really any mental health condition, or other vulnerabilities that have been in their history, that could include a family history of suicide or a past attempt. For all of those, it's very important to be thinking about protecting our mental health, engaging in supportive, healthy relationships in your life, and engaging in treatment. While we are in the midst of an unprecedented public health crisis, we also have an extraordinary opportunity to come together and concentrate on mental health. There has never been another infectious disease epidemic ever in history when mental health has been part of that national dialogue, and it is at this time. So it's a time when we can clearly focus on our mental health like never before, and we have certain other advantages. For example, the use of telehealth has suddenly skyrocketed into an available place because of the coronavirus. The federal government has passed legislation so that people can see a doctor if they think they have symptoms of coronavirus, but it also means that we can see a doctor or a therapist if we're concerned that our mental health is deteriorating. So I would encourage everyone to think about that and check your insurance to see if you have access to telemedicine or teletherapy. We must use these tools to our advantage and remain vigilant to protect our own mental health and to support our loved ones. I encourage everyone to engage in open and honest dialogue with your friends and with your loved ones. Check in with each other, ask how you're doing, be willing to share yourself. It is a more stressful time, so everybody's stress level is just a little bit elevated. So we need to actually show even more compassion and kindness. We need to practice self-care in spades. Now is not the time to forget about the basics of protecting your sleep, your nutrition, exercise, and that really means also drinking a lot more water than usual and drinking less alcohol than usual. And think about all of the other self-care activities that you know ground you. One last word of encouragement. Consider the people around you who others might not be thinking of reaching out to. Think especially about the elderly people in your life. Consider reaching out to them and offer to lend them a listening ear or a supportive hand in terms of errands or walking their dog, or really just expressing support. Even though this is a time of social distancing, to me, that really means physical distancing and not a time to socially disconnect. And so let's use technology in order to connect with loved ones and to be thinking about those who might be vulnerable during this time. Thank you again so much for participating in this program. Let's come together as families and communities and support one another during this time. Thank you.
Can we see it again? Everything good?
Yes.
All right.
All good.
Going back and forth between different programs screws it up sometimes. So mental health is a key part of our health, just like we have our physical health, we also have mental health. And also like physical health, we can practice proactive strategies to take care of our mental health. The brain is a physical organ in the body, and like every other organ, our health outcomes stem from a mixture of our biology and our life stressors and strategies. Both nature and nurture matter when it comes to our mental health, but we may not have realized the power we have in steering our course towards resiliency and healing. There are things we can do to protect our mental health, whether we have an existing mental health condition or not. 1 in 5 Americans have a mental health condition. So we've got adults with 2 million adults with serious mental health illness and 22 million adults with substance use disorders. Mental health conditions and substance use disorders are more prevalent than heart disease, diabetes, arthritis, migraines, osteoporosis, and asthma. When left unaddressed, mental health conditions have the potential to seriously negatively impact our life, our relationships, our ability to work, and even our physical health. Self-care strategies and care for one's mental health and well-being, including treatment for mental health conditions, is crucially important at all times, and especially during this time of uncertainty. Since we all have good days and bad days, how do we know when it warrants professional evaluation, support, or treatment? We shouldn't assume that just because there is an identifiable stressor that deteriorating mental health doesn't warrant attention. That would be like saying, I know why I'm having frequent chest pain, and so I can just watch it and see where it lands. Any of the signs and symptoms on this slide could indicate more significant changes in mental health that would benefit from professional help. We should be just as proactive about our mental health as we are with our physical health. So how to seek help? Remember to trust your gut instinct and know that even if it doesn't turn out to be a serious mental health condition, a therapeutic interaction with a mental health professional can still be very valuable. And here are some ways to find a mental health professional. Actually, I'll give those to you later. Sorry about that. This time of uncertainty means that it's more important than ever to look after and care for our mental health gardens. Here are some practical tips to be as proactive as possible about our mental health. Mental health and physical health are interrelated, and we know that taking care of our physical health can also support our mental health. Get a good night's sleep. Sleep is restorative and important to our physical health, and we all want to help our immune systems right now. Basic sleep hygiene rules include not using sedatives or alcohol to sleep and keeping to the same sleep hours. Move throughout the day as much as possible. This can include stretching, yoga, walking around the house, dancing, and playing active games. You can be creative with the activities which keep you physically active throughout the day. There are many meditation and breathing applications. A simple breathing exercise encourages inhaling for 4 seconds, holding the breath for 7 seconds, and exhale for 8 seconds. Drink water regularly and limit alcohol intake, which can worsen feelings of depression over time. Follow doctor's orders for prescribed medication and check with your pharmacy to see if they have delivery services if needed. Stay focused on what we can control. So stick to a daily routine. If you are working from home, don't work from bed. Get up, get dressed, and shower at your usual times. Have meals when you usually do. Limit news intake, including news on social media, if it is making you feel more anxious than connected. For example, turn off TV news. Limit your intake to 2 15-minute periods a day and read news from trusted resources. Engage in activities you don't normally have time for. You could watch some videos on things you want to learn about, journal, meditate, play with your pets. Again, you can get creative and find what works for you. Make your environment safe and comfortable. Pull out some creature comforts, such as your favorite blanket, scented candles, things like that. The power of human connectedness is strong in enhancing our well-being. Reach out to others when you're feeling lonely. Use technology and find creative ways to stay connected. Start group text chats that check in with each other regularly. Organize a coffee break via FaceTime, even though some coffee places are open. Again, I know Starbucks is not. Talk about things other than current news. Seek reassurance from others when you need it. Many therapists are able to provide online telehealth services via phone or video chat. Check with yours. If you're not in therapy and need support, a good starting point is to gather the names of a few whom you might call to schedule a first appointment. Check in on your older neighbors. Leave a note that lets them know you're available if they need anything, like help with a small errand. And write down other helpful resources and perhaps leave with a note on how they can access that service. It is important for young people to have ways to express their concerns and fears without judgment, to feel secure and supported. They don't have the life experience and may be struggling to see that this will pass. Listen, reassure them, and remind them that we're all in this together. Create virtual opportunities for socialization whenever possible, such as online chats or video calls. For kids with existing mental health issues, the uncertainty can heighten already difficult emotions. Encourage regular sleep, eating, and exercise. Make sure they are taking medication if it's prescribed, and be in touch with their mental health professional if needed. With younger children, try not to overload them with COVID-19 information. Provide extra reassurance. Find activities to do and ways to connect them with others. With kids that are going to be home more often, it's important to make sure your environment is safe. Make sure medications, firearms, and other items are stored securely. We also have a number of resources, including contacting your primary care provider and mental health professional. You can also contact employee benefits providers. A lot of employers have what's called an employee assistance program, and you can locate a mental health provider at findtreatment.samhsa.gov. We also have launched a webpage at AFSP that features blogs on protecting our mental health during this time of uncertainty and social media shareables to encourage other people and communities to protect our mental health. We can make a difference in making these messages widely heard and create a culture that's smart about mental health. We also have our suicide prevention lifeline. You can call 1-800-273-8255 or text the crisis text line at 741-741, and then the disaster distress hotline. And all of these are available at all times. And even if suicide isn't an immediate concern, if you're concerned about someone's mental health, you can use these resources to ask what the next steps can be and speak with a trained counselor. We also have NAMI Keystone, Pennsylvania, our Resolve Crisis Services, and services for teens at risk with the STAR Center. The most important reminder that we're talking about today is that AFSP is here for you. You are not alone. And if you have any questions or would like to request any chapter programs or resources, you can always email me at jpetkoski@afsp.org, and I can put that in the chat. And I thank you for joining me today. Where's the chat? There we go.
Thank you so much, Jessie. We can open this up now. I don't see any questions in the chat, but if anyone has questions, this is the time to do it. Jessie also has added her email in the chat. So if anyone wants to reach out in that way, that'd be great. So I see one, it says, are there resources? Oh, I guess you can see it now. You're not talking, so you can go.
Are there resources for loved ones who lost someone to suicide? Absolutely. We have, I have a listing of support groups that I can send out that are based either in Allegheny County or anywhere within the 25 counties that I cover. Some of them are listed on our website, some of them are not, and I'd be happy to share that with Andrea, and she can get it out to the group. It is a PDF document. We also have our Healing Conversations program. The Healing Conversations program is a program where a loss survivor can connect with a trained volunteer who is also a loss survivor to have a conversation about the loss and just provide resources and some information about how to move forward in that grief. And then we have our International Survivors of Suicide Loss Day. It is an all-day event. It's the day before, it's the Saturday before Thanksgiving, and it's free to attend, and we provide there's videos and speakers and breakout sessions with support group facilitators as well. And then we also have a number of, I think I went over some of the resources earlier in the presentation. We have ones for children's, teens, and loss. So it's a booklet, or you can download it digitally. And we also have a survivor of suicide loss digital booklet. I can send that to Andrea as well, and she can share it with who's on this call today. So I'll make sure to get those to her within the next day, and she can send that off.
Perfect. Are there any other questions?
You're welcome. And I know some of you are familiar with our organization, but we do all of our programming, everything at no cost. We are happy to get out there. Our Talk Saves Lives program is probably the one that we do the most, but just to give you an idea of other ones that we have, I talked a little bit about the It's Real Teens and Mental Health. I actually just did that presentation for a bunch of classes at North Hills School District, and it identify, and it's for 14 to 18-year-olds. It identifies and defines what mental health is, talks about how to start a conversation with someone who you're worried about, or to have a conversation with someone if you're worried about yourself. It gives you self-care tips and strategies and ways to navigate those conversations. And especially with that age group, people are afraid of. So if someone comes to me and says I have a problem, there are always what if questions. So what if they get mad at me, or what if they tell me not to talk about it? And ways to kind of address those situations. And then we have a new program called Gizmo's Possum Guide to Mental Health. I know, Andrea, I think you sat through that one. It's for 5 to 11-year-olds. It's a read along with Gizmo, who is a therapy dog. And it talks about mental health, and it talks about whenever we're feeling sad, mad, or worried, what those things can look like, activities we can engage in to make ourselves feel better, people who we can do things with, places we can go. And then it also helps identify who our trusted adults are, because the presentation is for 5 to 11-year-olds and their trusted adults. And then it encourages the child and the adult to make a daily mental health plan, and kind of go over like, well, how are we feeling today? Are we feeling any of these ways? Okay, we are. What would you like to do to feel better? Let's talk about that. So we can do these things in person, we can do them virtually, but they're really great programs. And then we also have one called Introduction to Supporting Those at Risk. So if you have people in your life who have had suicidal thoughts or have attempted suicide, this presentation is for the people who support those individuals. So giving resources and ways to help them through those times of crisis. So there, lots of things. And like I said, I see Becky's comment about the booklet. I will be happy to get that to Andrea, and she'll send that out. Because I think you have access to everybody's contact information, right?
Okay, so I think that looks like that might be it for the questions. Again, you know, your email has been shared, and if anyone wants to send any personal emails, you know, I think Jesse would be more than happy to receive those. And I will say that, again, our next two Live Well collaborative meetings will be second Tuesday of each month, November, December, at 10 a.m. So far, they've been running about 40 minutes, so we're not trying to take a lot of time from anyone, but we also feel like we have really valuable information that we want to spread. So eating health equity is in November, and then eating healthy on a budget is in December. Health equity will be someone from our equity director from the Allegheny County Health Department, and then eating on a budget will be a few members from Adagio Health will be speaking. So yes, I'm going to say thank you for coming. Jesse, thank you so much for speaking with our group today. It was so valuable, and this is such an important topic to talk about and to constantly be talking about. So thank you for opening up that dialogue with Live Well Allegheny. And I will just wish everyone a happy and healthy day, and we'll hopefully see everyone in November. Bye, everyone.
Thank you. Bye.
Bye. Thank you.